assume that you're a typical situation that we see where you have anywhere from 12 to 18 plans. You could successfully resign from those plans in as few as 6 months. If you want to take a little slower route, a little bit more deliberate route, a little bit more dot the I, cross the T. Naren, I'll share a funny saying that a mentor of mine introduced to me many years ago. And his name was Mike Farley. Naren, I don't think you've ever heard me mention his name. Mike was an accountant. He owned a large accounting firm that worked exclusively with dental offices. And he was one of my mentors for many years. And I have deep regard for Mike's way of thinking. And Mike would say sometimes, Gary, this is one where we're going to wear a belt and suspenders on this one. We're going to wear a belt and suspenders. Now, we don't, you don't see suspenders worn often these days, but we all know what suspenders are. So Naren, what do you think it means if we're advising the client to wear a belt and suspenders on this one? What does that mean? You got to make sure those pants stay up.
Yes. That makes sense.
So you're going to dot the I, cross the T, and go back and check it again. So regardless of what your style is, whether you're a bit more impulsive like Dan, or you're like Mike, where you're going to wear a belt and suspenders, you can do this in as quickly as 6 months. And if you want to be a little bit more deliberate, perhaps more in the 9 month to 12 month time frame, 9 months to 12 months. And even if you're starting with many plans, we can accomplish this within a 1 year time period. Now that may seem like a long time, a year. But if we can do it and keep the majority of your in-network patients, it's worth it to go through the process of doing it right. Because think of it, a year from now is going to happen anyway. You might as well have it happen where you've done all the work and successfully. Imagine how you'd feel a year from now to be completely resigned from all those plans successfully. Imagine how you'd feel. Imagine how that sets you up for the rest of your career. Think about that, Naren. What are your thoughts about that?
I think, you and I have used the PPO write-off calculator, right, Gary? And we have seen people losing 300,000, 400,000. I think the lowest we see nowadays is 400,000 a year. So imagine you stop.
You mean writing off the difference between their usual fees and their contracted fees?
Yes.
By the way, you might even remember this, Naren. We have seen that amount to over 7 digits, over $1 million of write-offs.
Every single year, yeah. So imagine that burden is no longer on your shoulders where you have to give, it's like you're working and you have to give up hundreds of thousands of dollars of what you make every year to the insurance company in the form of write-offs. So imagine not having that burden. I mean, I was talking to a client of mine today and, he might be a great client for you, Gary, because he needs help in how to reduce insurance dependence. He's killing it on Google. I mean, he's ranking for 300 keywords. 25,000 people are seeing him for every procedure. But the problem is all this PPO plans he's on is sucking up the life out of him because he's making, pennies on the dollar from those patients. But he doesn't have the time to do the cosmetic and all the other high value things he wants to do. So
he's got all the right circumstances that would say, let's do this now.
Yeah.
Of those 6 steps, the one step that I feel is most important, I kind of feel like these 6 steps are kind of like my children, where each one of them are equally important. Right. But if I had to pick one of these steps as most important, I would pick that we want to amplify or elevate the relationship-driven aspect of your practice. I would pick that as the most important of the 6 steps, because the more relationship driven we are, the less likely people are to leave. And then the second, right behind it, literally like right behind number 1, would be to master digital marketing. And because we need to replace any patients we're going to lose, and we're essentially going to replace Delta with Google. And Naren, you're the expert on that. You can't just flip the switch and one day be on page 17 if someone's looking for a dentist in your community, and the next day on page 1. So Naren, how long do you think it would take if an office was sort of doing middling when it came to their website and organic SEO? Maybe they're on page 2 or 3. How long would it take to get on page 1? And what would be a reasonable expectation for how long it would take to master digital marketing.
Absolutely. I like to under-promise and over-deliver. That's perhaps why 95% of our clients stay with us year after year. So what I tell my clients is, give us a year, and at the end of the year, you should be ranking for at least 100 search terms, and you should be getting at least 20 new patients just from Google organic marketing. And the beauty of that is it gets better and better over time. Like in your case, you've been with us. I mean, Life Smiles has been with us for 6+ years, and you are getting 100 new patient calls. After 5 years or so. So,
but also it doesn't go from zero to to full speed. It doesn't take that year. You start to see results along the way.
Absolutely. It's like many times
we started to see results along the way.
Yeah, immediately, like within months of the revamped site going up with all the fixes.
Yeah,
absolutely. And
so that kind of fits in my timeline of 6 months. To answer the question, how long will it take to successfully resign from PPO plans? 6 months on the fast track, 1 month on the more deliberate, calculated track. That kind of fits within that. Would you agree?
Absolutely, Gary. And by the way, if anybody needs some help in seeing how well they're doing with marketing or not doing with marketing, because you want those free patients from Google versus the expensive patients from your PPO plans, we can do a marketing strategy meeting. We can put a link, equa.com/MSM. We spend 6 hours studying where you are and how your competition is doing, and give you a list of things you need to fix plus a 12-month plan.
Yeah, that might also help you kind of realize what your timeline would be, because if you find out you're actually doing pretty well, it's just going to get better with Equa, then we could go faster. If you find out like that we're on page 17. By the way, I'm not making that up. We were on page 17 when we started with you, Naren, which, can we agree, was completely invisible?
I agree. And today you are on page 1 for 670 keywords, which is,
big difference.
awesome.
Big difference.